Chosen helps children heal from trauma of abuse and neglect by strengthening their families. Specifically, we work with foster families, adoptive families, and kinship caregivers such as grandparents raising grandchildren. This year, we need your help more than ever. During this COVID-19 outbreak, we are seeing unprecedented levels of strain and stress on families as their children are home from daycare and school, and their behaviors stemming from trauma are out of control. We have an increased volume of calls and need your support. We're specifically asking for $10,000 to cover the cost of our clinical assessments. These assessments measure things like anger, aggression, depression, PTSD, parental stress levels, and they create the roadmap for the treatment that we provide for these children and families. Because we measure at the beginning of services and 6 months into the services, we can also track progress with our families and make adjustments as needed. For example, I can tell you that 92% of our clients last year that measured in the clinical of depression, that dropped out of the clinical range into a non-clinical range. 71% of our clients who measured in a clinical range of anger and aggression dropped into a non-clinical range. Obviously, the services that we're providing are working, and they are paramount for these families to help heal these children. Because of these assessments, I can also tell you 100% of our families that have come to us and stayed for 6 months services have not quit on their children and put them back into the child welfare system, meaning we've had 100% success rate with those families. Addressing mental and behavioral health needs soon and early is absolutely critical in preventing tragic community outcomes such as substance abuse, homelessness, and even suicide. Thank you so much for providing for these critical services and these assessments for our families and children so that they can heal and be restored.